Hello and welcome to our presentation about pain medication. So let's start by talking about the role of medication in pain management. The first thing to look at is that the main goal is to improve function and general activity. So normally, patients might get some medications that could make them a bit too sleepy or a bit too drowsy, which is not exactly what we want when we talk about persistent pain. We want something that will improve activity and make you able to do the things that you like. This might be a run, or it might be just picking up your grandchild from school. So it's important to focus on that when we talk about medication for pain management. The other aspect that is important is that we always suggest that it's used in combination with other strategies, including physiotherapy and psychology. Why is that? As we know, pain is quite subjective and it can affect people in many ways. And as it becomes more persistent, the dimensions that it affects can be quite overwhelming. So it's not just going to affect you physically, but it might affect you psychologically and socially as well. Okay, so that's why we suggest that it's used in combination. And last but not least, all medications should be reviewed regularly by your GP or your pain specialist. It could be a doctor or a nurse, but it's important that your medication can be quite well monitored due to the side effects, but also because sometimes it might not be working as much as you would expect, but also because there might be other options for you that should be considered. If we look at the table now, we can see some of the medications that can be used for pain. Some might be well known to you, some might not. We have, for example, ibuprofen, which is quite common. But for example, we also have some antidepressants and anti-seizures medications that can be used for certain types of pain, what we call neuropathic pain. They can be used at lower doses to help managing some of the symptoms. Again, it's important to highlight that any medication that we use in management of chronic pain is to help managing the symptoms and not necessarily a cure or full treatment. It's also important to look at some of the other medications, for example, topical creams that can be used. And last but not least, we of course talk about opioids. The recommendation is to use less of them. You might have heard about morphine or oxycodone, which are mainly used for acute pain. So they are very good for surgical, post-surgical pain, but they might not be very beneficial in the long term due to the side effects, but also, for example, as people have heard before, the risk of addiction and overdose. So we need to be mindful that with any of the medications that we see here, we are considering the side effects and balancing them to make sure that they are giving you the best benefit. Now, let's talk a bit about evidence, because this is one of the limitations that we have, is that on top of the fact that it doesn't provide a cure, it doesn't treat, it only helps managing the symptoms, it's also important to point out that the evidence that we currently have for chronic pain medication is quite limited. But to give a few examples, we look at two numbers. We have the NNT, which is the number of patients that need to be treated for a medication to show an improvement of 30 to 50%. So again, we're not talking about a cure, about taking away the pain, but yes, we're talking about 30 to 50%. So we're looking at the lower number. We want, for example, 1 in 2 patients might get some benefit. But we also look, when we talk about persistent pain medication, about the NNH, which is the number of people that need to be treated to cause some harm. When you say some harm, is the side effects. That might be a little bit too much when compared to the benefit that you're receiving. We want, for example, 1 in 100 people, that would be the ideal number, to have side effects from a medication. But unfortunately, and then we can see some of the examples here, that it might not be the case when we're talking about persistent pain. But most of all, what we look at is the NNT, isn't it? How many patients need to be treated to actually get a benefit? So if we look at paracetamol, ibuprofen, we have some patients that will get a good response. But for example, if we look at duloxetine or gabapentin, that number might be a bit higher. I would also like to highlight the pain science education, something we talk about in our hospital and that we might be offering, which means that with this, with science education, with telling you strategies and techniques to help you managing your pain without any medication, we do have a low NNT, and what research is telling us is that the NNH is likely to be very high. So very rarely someone will have a problem with this kind of approach, but it might be helping quite a lot of people. So at least, for example, 1 in 3 patients might get a good response. So looking at some of the other limitations, we talked about the limited pain evidence, okay? But there's a few things that need to be talked about too. For example, the side effects. Some of you might be aware that most medications can cause some nausea, some diarrhea, some vomiting. But what we see as well with medication for persistent pain is that you can develop other persistent side effects like drowsiness, constipation, weight gain, and hormonal changes. And what happens is, because this medication needs to be taken regularly, you might be experiencing those side effects for a very long time. And if there's no balance between the benefit and the side effects, you might be harming yourself more than helping. That's why we are always looking for a balance between a medication and the side effects. It's also important to talk about tolerance, dependence, and addiction. So these medications, not just the opioids, they can cause some dependence, but also some tolerance, and at the last level, addiction. What happens is your body gets used to the medication, so it will ask for it, even though you might not be getting the benefit that you would like. Okay, so it's important to understand that these risks can happen when taking these medications. It's also important when we talk about persistent pain to point out that it does not address the psychological aspects. As we talked before, pain can affect people in many ways, not just physically, but also psychological, socially, etc. So that's why it's important to address those issues and not just use medication as the only technique, the only approach to help managing your pain. And that's why we want to combine the different types of approaches that can help you managing your pain a little bit better. And last, as we talked before, the limited evidence for long-term use means that the medication might help for a short period of time, but it might not help for a long period of time. And also because the side effects can overcome that benefit that you are having. So the most important thing that we want to highlight when we talk about medication for persistent pain is the balance. A balance between the benefit and the side effects. What we want is for you to require the minimum amount of a medication to increase your general activity and improve function without the undesirable side effects. So that's why we're looking at making sure that what you're having is the correct dose, is the correct medication for you, but also to understand if the medication is working for you, if it's something that needs to be maybe reduced or even stopped. Now, a common question that you might have is in terms of why don't certain medications work, or why doesn't it work for me but it works for someone else? As we mentioned, persistent pain has many causes, but it's still a bit not fully understood. So we don't really understand exactly how persistent pain can develop. So that's why not all medications might work. And even when we talk about chronic pain, when we talk about persistent pain, there are many different types of pain within that group. That's why it can be a little bit difficult to understand the mechanism and how they work for every person. And what we know is that some types of persistent pain might not respond to medication. And in those cases, the best option is to kind of not take anything, but also to look at all the techniques, all the strategies that will improve your function, but most importantly, look after your mental well-being. Each pain is very personal, and what works for one person might not work for the other. To conclude this presentation, I just would like to point out a few considerations about pain medication. To start with, when starting a medication, it should always be done slowly and reviewed by a specialist. As we talked about, these medications might cause some side effects, and sometimes they might not work for a specific patient. They might work for another, but not for everyone. So it's important to do it slowly and make sure that it's working for you. The second part is that in terms of chronic pain, we might not be talking about a medication that will help managing your symptoms very quickly, but it might take weeks or months to achieve that benefit. If a medication is not working or if it's causing too many side effects, it is important to consider reducing it or even stopping it. Make sure that what you're taking is not harming you. It's not affecting your activity, your function. We want you to be able to do more, but not less. And last but not least, in terms of any medication, always discuss with a GP, a pain specialist doctor, or a nurse for you to be able to reduce or change any of your medications.